Welcome to the Piedmont Triad Regional Council Area Agency on Aging, ARPA mini grants, recording number 4. This recording will provide information about the PTRC Area Agency on Aging's Family Caregiver Support Program, American Rescue Plan Act mini grant for North Carolina's Caregivers Trualta Platform Program promotion. In March of 2020, our region, Region G, entered the beginning of a national pandemic that has negatively affected older adults and family caregivers. As we begin 2022, we are hopeful this pandemic can be behind us and we can begin a national recovery. This request for application is for grant proposals funded by the American Rescue Plan Act of 2021, ARPA. ARPA funds provide a unique opportunity to consider the needs and services and service delivery that have the potential to respond to the unmet needs of older adults and family caregivers. The Piedmont Triad Regional Council is taking a regional approach to distributing these funds based on the priorities which have been established by the North Carolina Division of Aging and Adult Services. Service match is not required, and funds will remain available until expended or until September 30th, 2024, whichever comes first. Additional information is available on the PTRC website under the specific Family Caregiver Support Services link at www.ptrc.org/services/pandemic recovery funding opportunities. The PTRC Area Agency on Aging is making 5 mini grants for the Trualta promotion of $6,000 each. The goal of the Family Caregiver Support Program is for caregivers to be empowered through education, to be informed of services available to them that can support their own well-being, and to be connected to a support system that can help reduce their level of stress, social isolation, and caregiver burden. The North Carolina Division of Aging and Adult Services has partnered with Trualta to offer an easy-to-use, personalized, and evidence-based on-demand learning platform for family caregivers across the state of North Carolina. North Carolina caregivers may access the portal at the home North Carolina Trualta website, nc-caregivers.com. Awarded grantees will advance the visibility and use of this platform portal within the region to both family caregivers and family caregiver support program providers, with the objective of increasing the number of family caregivers accessing the platform portal. In addition, they will increase family caregiver support program providers' appreciation of the benefits it offers to their family caregivers that they encounter in their work on a daily basis, and the portal's ability to increase the family caregiver providers' capacity to share vital caregiver information on a timely basis. The types of services that would be included in this mini grant include information. That's a service for caregivers that provides the public and individuals with information on resources and services available within their own communities. This mini grant will focus on providing information about Trualta North Carolina Caregiver Portal that will encourage caregivers to register and regularly access the portal for the information and support they need. Examples of activities aimed at promoting Trualta North Carolina Caregiver Portal include community and program advocacy, outreach, assessment, planning, documentation, evaluation and oversight, organization or participation in community events such as job fairs, health fairs, senior center fairs, program promotion, including public service announcements, public information, example, printing, publications, and program brochures. Administrative functions may include community and program advocacy, outreach, assessment, planning, documentation, oversight, developing public information, and organization or participation in community events. There is a cost computation requirement. An accurately completed Family Caregiver Support Program budget form will be required of all ARPA Family Caregiver Support Services Award recipients. Reimbursement for the Family Caregiver Support Program services. The ARPA Family Caregiver Support Program reimbursements are handled through a reimbursement system known as the Aging Resource Management System, or ARMS. Reimbursements are dependent upon the accurate reporting of the services data. Monitoring of all recipients will be provided and will be handled by the PTRC Area Agency on Aging according to a timeline established by the North Carolina Division of Aging and Adult Services. Confidentiality and security. Any client information in any format, whether recorded or not, should be kept confidential and not disclosed in any form that identifies the person without that person's informed consent or legal representation. Record retention and disposition. All community services providers are responsible for maintaining custody of records and documentations to support the allowable expenditures of funds, service provision, and the reimbursement of services. Service providers must adhere to the approved record retention and disposition schedule posted semi-annually on the website of the North Carolina Department of Health and Human Services Controller at ncdhhs.gov /about/administrative offices /office-controller/records.retention. That link is included in this RFA. Service providers are not authorized to destroy records related to the provision of services under this agreement, except in compliance with the approved DHHS retention and disposition schedule. Records that are destroyed will be destroyed in such a manner that the records cannot practically be read or reconstructed. The project period for this mini grant is May the 1st, 2022 through September 30th, 2024. Should be noted that the PTRC Area Agency on Aging reserves the right to reject any or all applications, waive technicalities, and to be the sole judge of suitability of services for their intended use, and further specifically reserves the right to make the award in the best interest of the PTRC Area Agency Regional Program. What follows is information about submitting the application for the Family Caregiver Support Program. 3 copies of the request for application will be required with original signatures. They must be received at the PTRC Area Agency on Aging offices at 1398 Carrollton Crossing Drive, Kernersville, no later than April the 1st, 2022 at 4 p.m. And they should be addressed to the attention of Gwen Shields. Proposals that best meet the PTRC Area Agency on Aging expectations for service delivery will be selected, and applications will be scored based on their completeness and description of intent to provide the service. Failure to respond to any requirements outlined in the RFA or failure to enclose completed copies of required documents may disqualify the application. Once again, the timeline, the announcement of funding availability is March 10th, 2022. The information sessions are recorded on a link within this RFA. Again, the final day to submit questions will be March 23rd, 2022. Those submission of questions should be in writing to the attention of Gwen Shields at the PTRC Area Agency on Aging. Applications are due no later than April the 1st, 2022 at 4 p.m. and award announcements will be made during the week of April the 25th. Upon the award of a grant, an official budget will be requested and must be completed using the required ARPA Family Caregiver Support Program budget paperwork. Again, there are 5 mini grants for up to $6,000 each for this North Carolina Caregivers Trualta platform promotion. All expenditures must be reasonable, necessary, and justifiable. All funds must be spent on activities related to this mini grant. Any organization may submit one application to provide services to multiple locations or counties, and requested grant amounts cannot exceed $6,000. Following that, you will see the ARPA Family Caregiver Support Program request for application itself. And again, 3 copies of the request will be required with original signatures. They must be submitted to the attention of Gwen Shields, 1398 Carrollton Crossing Drive, Kernersville, at the PTRC Area Agency on Aging, no later than April the 1st, 2022 at 4 p.m. It should include all the information that follows, including project contact information, the organization's full legal name, the project director, mailing address, phone number, board chair, if applicable, a tax ID number, which is required, a valid DUNS number, which is required, and the type of agency submitting the application. Also to be submitted is a copy of your organization's most recent financial statements, either audited or unaudited. For those organizations who are submitting unaudited financial statements, a completed state grant certification and sworn statement and a completed schedule of receipts and expenditures is also required. In addition, other information may be requested. There are 5 questions which follow. You may expand on the space that's provided. Word count is not limited. And following that question section, there is also a request for a budget proposal, which you will see. We ask that you be as accurate as possible with this budget proposal, listing everything that you will be including. This budget proposal should match the formal budget that paperwork that will be submitted afterwards. So in other words, if you include something, if you are going to include that request in your formal budget proposal, it needs to be outlined on this proposal with the RFA. Following that budget proposal is the American Rescue Plan Act bid certification statement. Please read that thoroughly. And also following that is the execution of the RFA itself, which should include a printed name, an authorized signature, that authorized signature's title, and the date. Again, we are requesting 3 copies, original copies of this RFA, all with original signatures. And again, it must be submitted no later than April the 1st, 2022 to our offices by 4 p.m. and to the attention of Gwen Shields. I encourage everyone to read the RFA completely for themselves. And again, if they have questions, please submit those in writing no later than March the 23rd, 2022 at 4 p.m. to the attention of Gwen Shields. Thank you.